So when you come to see us, you'll get to meet the front office and the staff. The assisting staff will then take you back and find out why you picked up the phone. What's going on? What are the challenges that you're having? We'll then take a series of x-rays, whether it's a full 3D CT, maybe some intraoral x-rays. And my assistants will sit down and they will talk to you and they will show you some of our options that we have. Me or Dr. Dupree will be studying your case on the 3D CT, and then we'll evaluate your candidacy for implants. Generally, every patient is. We have advanced bone techniques, we have advanced implant techniques for minimal or no bone, such as zygomatics or pterygoids. So generally, no patient is turned away. So after your doctor reviews the CT scan, we will go in and meet you. We will determine what is your goal of treatment, what anatomical challenges do we have, why this is important to you, and what your options are. Some patients come in knowing exactly what they want. Some patients know they want implants right out the door. Some patients may need some options. Some patients may be faced with other challenges, and we may have to phase in a denture or something like that. But we want to give all of our patients options if they want that. We don't do things just one way. We try to meet our patients' needs. After your initial discussion with the doctor, we'll present to you our treatment coordinator. We have some great treatment coordinators here, and they will come in and explain any questions you have, go over financing options. Beyond that, if patients are ready to go, we can take impressions that day and actually get the process of getting permanent implanted teeth started that day.